So a dental implant is the contemporary version of tooth replacement. So historically, teeth were replaced utilizing other teeth and they just did it as best as they could. Now we use what we would liken to a tooth root that's developed out of titanium. That fixture is placed into the bone, then your dentist can actually use that stabilization to build a tooth upon. So the reality of it is we give you a tooth back that mimics the natural tooth. It's easy to clean, really requires no additional daily measures to maintain, and so it becomes a natural, more ideal way to replace a missing tooth. So 3 common questions that we get regarding dental implants is, 1, am I a good candidate? And so part of our evaluation process is determine if indeed you are a good candidate. And so some of the things that we look at is the health of the mouth. There are certain rare circumstances where the patient's overall medical health does not warrant that they are a good candidate. But for the most part, patients that are missing teeth are good candidates for dental implants as long as they don't have significant generalized dental disease in their mouth. The second question is, does it hurt? Typically, when we place dental implants, it is a surgical procedure, so we make a small incision. This can be done with local anesthesia. You can be asleep for these procedures. Typically, though, what we tell patients and what they experience is some discomfort for 48 hours, typically, where you can take an over-the-counter medication to help with the discomfort. Quite often, the patients go back to work the same day. The third most common question about dental implants is, what does it cost? Well, there are a ton of factors that go into cost. There are additional procedures occasionally that we have to perform so that we can make the location ideal for implant placement. And so really the cost varies per patient, but rest assured, once we are finished with this consultation, we will have a laid out treatment process and treatment plan for you. So in summary, dental implants really allow us a contemporary method of replacing your missing teeth, which will allow you to eat properly again, to potentially support dentures, removable teeth that aren't comfortable. It will really allow a long-term solution so that it is not something that you are dealing with every 10 to 15 years. It is a predictable long-term solution that will improve the lifestyle of our patients.